Schizophrenia is a brain disorder that affects the way a person thinks, reacts, relates to others, and it distorts their perception of reality. About 1% of the American population will eventually develop schizophrenia within their lifetime. That is about 2.2 million Americans. There are 5 different subtypes of schizophrenia, which include paranoid, disorganized, residual, catatonic, and undifferentiated schizophrenia. This brain disorder typically starts when a person is in their teens or in their early 20s. Schizophrenia can be hereditary, or it can be developed through brain chemistry, brain abnormalities, and environmental factors.
For people with schizophrenia, hospitalization is done so they can get the proper treatment and medication that they need. The first time that they go to the hospital is usually after their first psychotic episode. They're taken to the hospital to get tests done. Here, doctors go over the patient's physical, psychiatric, and psychological profiles, and they also examine the psychological history of the family. Because most schizophrenics may not realize that they're ill, that can result in them not taking their medication properly, which can cause them to have episodes or even for their episodes to worsen. That's where the mental health institutions come in. These are institutions strictly based on dealing with mental health patients where they stay until they are fully taken care of and back to their normal selves. Here, doctors prescribe them with the right medications and make sure that they're taking them daily as prescribed. Most of the visits after the first one are usually due to the patient not taking their medication properly, or if they're abusing drugs, all of which causes them to have another episode. There are voluntary and there are involuntary commitments. Most schizophrenics who voluntarily commit go if they're not feeling like themselves and they feel like another episode is upon them and they're seeking help. Others who involuntary commit are usually ones who have stopped taking their medication and another episode has already started for them. They are usually committed by the police or their family after being violent to others and sometimes suicide threats. Being back and forth with hospitalization may continue throughout a long period in one's life, but is usually controlled after so many years.
Schizophrenia treatment can include medications such as second-generation antipsychotics and first-generation antipsychotics. First-generation antipsychotics can cause neurological side effects and can cause a movement disorder. Second-generation antipsychotics are less harmful. Treatments can also include long-acting injectable antipsychotics and can be administered every 2 to 4 weeks depending on the medication. Another form of treatment is psychosocial interventions. This can include individual therapy, social skills training, family therapy, and vocational rehabilitation. Hospitalization and electroconvulsive therapy are also treatment options.
Schizophrenia is a brain disorder that affects about 2 million Americans. Symptoms include having hallucinations and delusions about life. They'll feel and hear things that aren't there, and they'll also see things that aren't there. This might cause trouble sleeping and will also cause depression. They'll tend to withdraw from family and friends, and they'll have a disregard for anything schoolwork or extracurricular activities. These symptoms can be related to the effects of LSD, methamphetamine, acid, and strong strains of marijuana.